Welcome back to the second half of Lecture 1 from Part 2. We are continuing on how AI can help us. Just as a refresher, we are going over 5 characteristics that make AI helpful. We have decision making, which we've talked about, efficiency, and now we are going to touch on accuracy. So what is accuracy? For this lecture, let's define accuracy very simply as getting it right. So the assumption, of course, is that, what you're measuring is what you've intended to measure. So the actual measurement is representative of the concept of what you are intending to measure. So I know that's a little convoluted, but it is important because you need to be sure that even though you intend to measure something, so let's say it is blood pressure, what you're, the device you're using or the mechanism by which you're measuring blood pressure, what it yields is a good representation of the concept of blood pressure. Because you can imagine if you were to try and measure blood pressure through something that is not a good measure of blood pressure, then you have a problem when it comes to accuracy. Because accuracy in this case is going to be, we got it right. We've got the closest answer to the truth that is possible. So now inevitably, when you're working with AI machine learning solutions, with the rapid improvements that we're seeing in, computer processing technology, all AI-based systems are already improving in terms of accuracy and efficiency, what we just talked about, for diagnosis and treatment. And that's the interest in these, methods that contain or are powered by artificial intelligence machine learning, is that they are accurate and they are efficient in giving you the answer. That's, of course, the utility behind this new technology. So let's move on to an example for accuracy. So the one we're going to use here is drug dosage, and in this case, it's going to be corticosteroid drug dosage. And it is in the context is for the treatment of glioblastoma patients or brain cancer, where when you treat the glioblastoma in order to reduce the size of the tumor or excise it, you have to also be mindful of the swelling or edema in the brain that occurs due to your treatment. And in order to reduce the swelling and the edema in the brain, corticosteroids are used. The problem, though, is there's this tricky balance of how much corticosteroid to use, when to use it, so that you don't have ill effects or comorbidities due to the corticosteroid usage. And so this is where there's an example where physicians, there was a study and they often make dosage mistakes. With one example, obviously it's probably an outlier or something like that, but, one medical site, the error reached 50%. And so the question is, can we find a way to more accurately calculate the required corticosteroid dosage for a given patient during treatment? And so reinforced learning, which is one of the 3 types of machine learning, which we've discussed already, can be used in order to dramatically cut the toxic chemotherapy and radiotherapy by optimizing treatment plans and drug dosages, in this case corticosteroids, for the glioblastoma patients. So how would we approach this? We would first, have the model go through a database of, the traditionally administered regimens drawn from, many years of studies, at first in animal studies, of course, and then observational trials and clinical practice with humans. And then the model will decide whether to initiate or withhold a dose during each planned dosing interval for the treatment of glioblastoma. Now, if the model decides to administer a dose, it then determines whether it's full dose or just a portion, and for what is necessary for the optimal treatment. And that's the piece, that's where the complication comes in, right? So you're thinking, okay, so I'm dealing with artificial intelligence. I have a lot of compute power. I have a lot of data. So that's great. So that's going through, years and years and years and years of examples or regimens or, observational, data. And then the tricky part is, well, how do we decide, what the dosage should be and when, in order to optimize the treatment? And so what, the model is going to do is it's going to take all this data, and it's going to, basically learn from all of the different examples, samples, or instances of dosing and treatment outcome, and it's going to recognize features that it can, classify basically patients by, and then it will decide, which dosage would fit best for that patient to maximize a positive outcome. Okay, let's turn our attention to precision. Precision is very closely related to accuracy, but the difference is that in precision, what we're interested in is minimizing the difference between repeated measurements. So if you were to take repeated measurements of the same thing, same entity, what you want is them to be very, very close. So minimizing the difference between them. It doesn't matter if what you're measuring is not accurate, in the sense that it doesn't represent the intended target, the intended measurement. But every time you actually perform the measurement of the same thing, for instance, that's the easiest way to remember it, they're very, very close. So an example of that is like the bullseye, and if you throw 3 darts and you land them all in the bullseye, well, there are 3 very accurate throws because that's where you want it to throw, in the bullseye, and they're also very precise because all 3 of them are in the bullseye. If you were to throw the 3 darts, and they were to all land in the 20 above the bullseye, then again they are precise because all 3 landed in the 20 all grouped together. However, they're not accurate because they're not in the bullseye. So that's how we're going to, for all intents and purposes, that's what we're going to consider precision versus accuracy. And as an example, in surgery, for instance, you have cognitive assisted robots or robotics in surgery, which assists the surgeon in making incisions, and instead of a single large or multiple large incisions, they're replaced with a series of smaller incisions, and they use different surgical instruments. And the reason they do this is to increase precision. So your cuts or your series of incisions are going to be positioned with precision to where you would like them to be, and not only where you'd like them to be, but in respect to each other. So surgeons integrate all the data from pre-op records, and then they look at their real-time operating metrics to improve the outcomes. And that's the important thing in surgery is your surgical outcomes, because you want to make sure that post-surgery that the patient recovers as quickly and as best as possible. So here's an example of where precision artificial intelligence, machine learning can help in precision in this case, in surgery. So carrying on with this surgical example, there's the Vinci surgical system with robotic limbs, which can provide high definition, magnified 3D view of the surgical site. So this is an assistive surgical device, which is controlled remotely by a surgeon from a console. Now, this is, to continue the example of precision for surgical instrument. But the interesting part is that it also has, an administrative side to the system, where it can automate non-patient care activities, such as writing chart notes, prescribing medications, and ordering tests, which once again minimize, the burden for the surgeon, who can then concentrate or focus more on the important task, which is the actual surgery, and performing the surgery in such a way to minimize negative outcomes post surgery. Here's just a few pictures of this Da Vinci system, just out of interest. They're actually pretty cool looking. I must say, if I was in the surgical theater, getting ready to be operated on, I had this thing kind of, positioned, near me or above me, I'd be a little bit freaked out. I would suspect they don't do that, of course, but still, it's just interesting. Now, the information cart on the far right is what I was talking about, that it will allow the surgeon not only to control the surgery, but also to perform, kind of the more mundane tasks that need to be done for every surgery. And so then it allows the surgeon to focus on what they need to get done, and they don't have to worry about missing, the appropriate follow-up, prescriptions and whatnot that have to occur after the surgery. So once again, kind of in conclusion, you have an AI-based system that is depending on machine learning, of course, but it's helping healthcare providers not only perform the task at hand, whether it be just assistive, as it is in this case, it's not doing it for them, but it's helping them, but more importantly, it's cutting down on documentation time, and this will improve reporting quality. And believe it or not, and I'm sure you've come across this before, it is important to have appropriate reporting for follow-up later, which contributes to positive or good patient outcomes. And so all of it together leads to much better, and efficient and accurate and precise delivery of healthcare. So the last characteristic we're going to discuss is the user needs. So supporting user needs. Now, the user, of course, can be many. It can be the healthcare professional, or it could be the patient, for that matter. So AI or AI machine learning can look for data, to help people find full information on the topic of interest. That's an example we've already talked about with, IBM Watson, which provides a very sophisticated tool in order to scour the internet and all of the literature in order to find your, answers to your research question, for instance. Why is that, useful? Well, because, all of the data that's out there is not all structured in a single format that's easily accessible and queryable by your computer. It is out there in different formats, and it's unstructured in the sense that it's not in a format that allows for easy access for keyword searching or indexing. And so you need software in order to deal with all those different formats and structures of data to try and put it all together and look for the item keywords of interest that you have. The other thing too is, of course, this is something that may be performed routinely, and something that needs to be done repetitively. And if that's the case, you want a system that's efficient, that's going to do it not only accurately, so as we discussed, meaning that you're actually measuring what you intend to measure, but also precisely, so meaning no matter what you're measuring, you have reliability in what you're measuring. Another example, if the user, for instance, is a radiologist, it's a tool that's going to provide the radiologist with some quantification or segmentation, of course, with the option for pattern recognition as well. But just in terms of user needs. Quantification and segmentation would be very useful because that's often something that radiologists do. They have to measure an area so that they can compare it, in a follow-up down the road, 3 months later or 6 months later, and then they receive the follow-up scan and they have to measure it again and just see if, relatively there's a difference between the two. Segmentation is becoming more and more, required, I guess. It's not required, but often it is something that is, of importance in the sense that you want to actually trace, the entire circumference, for instance, of a tumor. And then that way you can calculate the surface area from it. And if you have multiple slices, you can estimate the volume. And so segmentation is becoming more and more of a used tool, especially now with this interface with AI and machine learning, that you can share with AI what you've segmented so that it can learn segmentation and then perform the segmentation for you. And there's an example of supporting the user need. And in this case, the user is the radiologist. Let's go back to the IBM Watson style AI tool where it can search structured and unstructured medical records to provide relevant patient histories, for instance. The other use to this is to target similarities and patterns within the patient records, where it can then help researchers create patient cohorts, for instance, for a study or clinical trial that they're performing. So this is definitely something of interest especially in the pharmaceutical industry, and that is to help them build the best cohorts in order to perform a trial. Now, of course, leveraging AI machine learning solutions allows you to, lessen your burden of, repetitive mundane tasks such as documentation. But ultimately, the interest is in order for you to be able to focus on what is important, and that is the patient. And so, there's examples where, physicians who use documentation support and dictation assistance, end up engaging more with their patients. So having more time to spend with their patients, which is important, especially to the patient. And this is something that's been remarked by many patients, is that they actually appreciate it when the physician doesn't appear rushed or distracted, or engaged, like they feeling that the physician is actually engaged with them. And that's only possible if the physician isn't constantly juggling a whole bunch of things that they have to do, and they mustn't forget to do, and for each visit, because inevitably they see a lot of patients all the time. And so that's where we're hoping that this type of technology is going to provide that to medical professionals, is the ability to focus on the patient more. Now, I'm sure you all remember that electronic health records was going to change medicine forever, and that was many years ago, probably a good 15 years ago, that this was a big focus, and there's a lot of money put into this, and unfortunately it didn't really happen, in the sense that even though electronic health records exist today, of course, what was hoped that they would bring never arrived. And I would say there's a couple of reasons for that. One is, first and foremost, is when the electronic health records systems were developed or designed, they did not include medical professionals as stakeholders at the table for the design. And by doing so, they made the delivery of this new product, electronic health record, a lot more challenging, because the medical profession felt that they weren't included in the process, and therefore there was resistance to accept it. That's one reason. The other reason is that there was too much disparity between the systems in that there were just so many different ways to do it and so many different systems, and there was no standard that was adopted, that it made it extremely difficult to implement these systems, all basically siloed, so meaning that you have one system for this institution, another for that institution, and therefore the whole advantage of an electronic health record, which was to be able to share the information easily across systems, that just wasn't possible. And even today, I mean, obviously it's improved much more now, but it took that long for it to come together, and still it is a challenge to be able to share your health records anywhere within the country, for instance. So I kind of started, talking a little too much in the previous slide, but there's room for improvement in the EHR space, and here's some of the reasons why. So clunky interfaces. That's the not having the appropriate stakeholders at the table in order to as part of the design of your software, because what would be considered clunky means that users don't enjoy using them. They're not intuitive, and they don't provide what the user wants in a digestible format. The information not flowing easily between providers, that's the lack of standardization for sure. And then this whole seamless and automatic delivery of data, which is what one would expect from this type of a system, just doesn't really exist yet. It's very, very close now, but for years and years and years, it just wasn't there. And so then, of course, that opens the door to the problems of what if patients change physicians, or they change, institutions, and they move across their company, across the country, not their company. The challenge, of course, is having access to their records anywhere. And so, though we are definitely, getting close, we're still not there yet. And this is a process that started, easily 15 to 20 years ago. Okay, so what are some quick fixes? I mean, obviously we can just, redo everything and put in place a wonderful utopic system. Great. Sure, that might happen down the road, but how can we deal with it now with the technology advances that we have now? So one thing hospitals are doing is they actually literally have scribes sit in on appointments to document the visit while the physician interacts directly with the patient and provides that engagement that the patient wants. But you can imagine you don't actually need a physical person to be a scribe. You can have digital scribes, and this is something I'm sure you can all relate to very, very well now. Whereas just a few years ago, we would have said, "Oh yeah, a machine learning algorithm can do this for you." You'd be like, "Oh come on, it's going to be terrible." But no, not anymore, because of the latest and greatest in artificial intelligence, autocorrect and dictation and other technologies are now available, and so a digital scribe is a very real possibility, and that's going to work extremely well, in the sense that because it has the ability to learn from the data entry of thousands, if not hundreds of thousands, if not millions of users, then it's going to be able to appreciate the subtle differences in the language in order to correctly or accurately and precisely translate digitally the appointment that it would be sitting in on with the physician. So that's something that is interesting, that AI is not only going to be able to provide ultimately a much better solution, but it can also provide immediately some I guess interim fixes until we get our act together and have an appropriately standard centralized system. Okay, let's spend a little time on looking at what the possible impact of all this AI and machine learning will be on radiologists. So I think essentially AI will become part of what the radiologists do. and it will hopefully make their work more efficient and accurate. And this, of course, will leave them the time to focus on what they think is important. Now, there is also the interesting caveat that if you have a healthcare system that already possesses an effective data collection strategy, then they will definitely benefit the most by implementing an AI-based application system for their data management. If the healthcare system does not have an effective data collection strategy, an electronic data collection strategy, then applying AI is just going to be too much of a barrier, too much of a hurdle for them because they're just not ready. And so that's just an interesting thing to think of. Is AI definitely needs already in place an appropriate infrastructure for us to benefit from it. Now, as well, which I'm sure is in the back of everyone's minds, oh, well, can AI, machine learning, replace the radiologist? I think eventually, yes, it could replace radiologists, but by then the radiologist job will have changed in order to accommodate AI, and therefore they are going to be performing tasks that are better suited to them, to the radiologist, than AI, and so they won't be replaced. It's just their job will be different than it is today. And so what that's going to look like in the closer future, I think, is that even within the next 10 years, medical images will be first pre-analyzed by an AI tool before being reviewed by a radiologist. And what this will allow the system to do is basically triage. The more important scans to be reviewed will be sent to the top of the list for the radiologist, and the more simple, very basically normal or rule out images or scans will be left for later on in the day, at the end of the radiologist's day, or ultimately they will be able to be signed off just by the software because they're just so obvious, so basic that and the risk is low that the system will be able to sign off on them on their own. Now, the idea of quantification in radiology is certainly not new. It has been sought after for many, many years. It's just been slow to come because how do you do it? Very often you have to actually do it by hand, yourself on the computer. You didn't really have, systems like CAD systems that let you do it easily. That's changed. There's more and more systems. It's easier and easier to do, but it's still, the radiologist that actually has to do it manually. And so, with AI, this is going to become something that can be automated, right? So the segmentation can be automated, and then of course the quantification follows with it once you have the segmentation. So we will actually be seeing more and more quantification, which is fantastic in the world of radiology. And this will be because the AI system takes away that repetitive, kind of boring task of segmenting by the radiologist. And so, this will inevitably, by doing quantification, will also help to isolate and identify the lesions for analysis. And not only will this save time, but it also then lends to a better integration with pathology. Because in that sense, you can imagine there's a lot of AI in pathology, which will be doing the same thing, looking to segment or identify and segment lesions from the pathological perspective. So then you get this nice overlap between radiology and pathology. So how about the physicians? I mean, it's funny, we always focus on radiologists, dermatologists, and pathologists, kind of saying, oh, they're the most at risk for AI. And, maybe they are, but I'll tell you, I don't believe that physicians are going to get away, scot-free, untouched by this advent of AI. I think definitely their jobs will change inevitably as well. So once again, I think the right approach is to have artificial intelligence and machine learning assist or augment what the physician does. And what I think is unlikely is that their relationship with the patient will ever be replaced. I think that's going to be an important component that will probably stay around for a long time. You can certainly look at the parallel with chatbots. So I think, someone might say, well, you could have a physician chatbot. And yes, you could. But I think, if you're shopping at Home Depot and you need a little assistance in terms of, finding an item or, returning an item or something like that, and you have a chatbot that's assisting you get what you want, which is your money back or to return the item or to find something, then I think people are very tolerant of it and they'll say, whatever, I got the answer I need. It was really easy. It was in the bottom right corner of my screen. Perfect, right? But I don't think that's going to happen when it comes to, the treatment of patients who are, ill, in pain, they're stressed, they're anxious, they don't know what's going on. That relationship, I think will be extremely difficult to replace. And not only that, I think it would be wrong to replace it. And so that's where, AI has to be developed, hand in hand with the users, the stakeholders, in this case, the physicians, in order to ultimately enhance the workplace. Now, of course, what AI is also hopefully going to assist in is an accelerated path of discovery. So meaning that, gaining new insight, getting to that breakthrough that you are feverishly working towards in your career is potentially going to be accelerated due to AI technology. And all of that can do, nothing but improve ultimately clinical practice or patient outcomes. So you're all, I'm sure, thinking, okay, well, that sounds great. Have these accelerated, path to discovery and breakthroughs. Wonderful. How do we do that? Well, in our world of medical imaging, inevitably, what we're looking at and what I think will produce the most success now is going to be looking at the imaging data. What is available from the main imaging technologies such as ultrasound, CT, MRI, and PET. So that brings us to the end of lecture 1. And in part 3, in the first lecture, we are going to talk about image recognition in medical imaging and how AI machine learning can help us, perform research with medical images. See you there.